Okay, welcome. We're going to take a look at how to complete a PCR, or patient care report, within FP2. So we start off by getting in FP2, going to incidents, and opening up the file that we're going to be completing. So I'm just going to randomly choose a file here. Alright, and so the medical PCR is just one more step within the completion of the incident file. So when we complete the incident files, we work left to right through the tabs, kind of top to bottom through all the information here. So general times, truck chart, personnel, and so on. And then we'll get to this medical tab. We get to the medical tab to input a PCR. We check on the green plus box here. Select patient care report. Alright, and here is our PCR. Now remember that we're completing a PCR for every patient that receives care. So if we have one patient that received care by us, then it's one PCR. If there were two patients, then it's two PCRs, and so on. Now the great thing about working with an FP2 is that it pulls information from the file. So as you went through and completed that incident file, it's going to pull that information, like time you arrived on scene. So a lot of the required information is actually pulled through. We don't have to input it. There are a series of tabs here. As we will go through these tabs, you'll see some of these tabs are completely optional. Other tabs have just some optional information within them. So in this first main tab, we need to put in the unit number. Now this is the unit number that responded for the medical purposes. Now there's multiple units that responded to that call. You choose the unit that is most applicable. So I'm going to put in a unit number here. Under patient information, most of this information is actually required. So we have to have a gender. Let's say it was a male, it was an adult. Responder impression code. This is where we select one of the four colors. This information is in that reference sheet that was sent out to everybody. It's within the Moodle class, and it's also in the G drive. Just a reference sheet on how to complete the PCR. So in this case, we're going to say this impression was green. And we also have to give a chief complaint. Now the chief complaint should explain why you were called to the scene or why the patient is being treated. The chief complaint is not the cause of the injury. So for example, a chief complaint could be the pain to the right lower arm. It is not the fact that the patient fell from a ladder. Using the patient's own words is an appropriate practice if they describe symptoms of their chief complaint. So in this case, let's go with pain to the right lower arm. Okay, the next tab is completely optional. This is their assessment of the patient. We can input this information or we can skip over it. Area of injury, again, completely optional. Vitals, another one, it's completely optional, but if we did record vitals, then we input them here. Treatment, what treatment did we provide? Again, this is an optional. We go to our last tab here, which is history and treatment, and there's just one more spot that's required, and that's the responder level. This is where you have to select your current certified level of medical training. SFA being standard first aid and FMR being first medical responder. Now it's really important that you select the level that you're currently certified for. Someone who did an EMR course years ago but is no longer certified or insured should not be selecting EMR. Same with FMR. If you did an FM course years ago but it's no longer valid, you would not select that. You need to select the level that you're currently certified for. Now at this point we have inputted all the required information into the PCR, so it's complete. So we're going to hit that green check box. This will pop up every time. It says you will not be able to submit this until validation is complete. Please go to the action menu, validate, to see which fields are missing. Now if you've gone through and you've inputted all the required information, again you'll have the reference sheet, then you can click OK, ignore it, and close the file. You're done. There is one last step, and it's the reason why that window pops up, and this is the review stage. And this is something that administration does. So when we go through each month and review each file and close them out, for the PCRs we would select this box in our name here saying that it is reviewed. Okay, so for all intents and purposes, for when you do your PCRs, if you have completed it and have everything in that needs to be there, you click OK, close the box, and you can see now that your PCR that you had created is there and is available. So that's creating a PCR within FP2.